I'm John Eagles, and I used to work as a consultant psychiatrist in Aberdeen. Since retiring, I've become involved in the development of the Temple V program. The subject of this webinar is binge eating. I shall mention some psychological effects of binge eating as well, but within the Temple V program, its most striking effects are on a person's weight and physical well-being. Binge eating makes it difficult to lose weight, and perhaps more importantly, if binge eating is not addressed, then it is highly likely to sabotage a person's efforts to maintain any weight loss once that has been achieved. So, what is a binge, and how would we define it? The first feature is that a lot of food is eaten, the person deems it to be excessive, and almost always it is more than the average person would eat. Usually, but not always, it is eaten quickly, and since people tend to be ashamed of doing it, binging is usually done strictly in private. A crucial element of a binge is that the person feels that he or she has lost control of their eating during the binge. They feel out of control. A quick mention of bulimia nervosa, this being a more serious subtype of binge eating. People with bulimia nervosa have a real preoccupation with their body shape and their weight. They binge frequently and feel out of control. The big difference from what you might call ordinary binging is that people with bulimia nervosa engage in extreme methods of weight control, most commonly vomiting, sometimes laxative misuse, and sometimes excessive exercising. If you do have bulimia nervosa, then the Temple V program is not for you unless and until you have recovered. And it would be best to seek professional help from a psychiatrist, a psychologist, or a specialist counsellor. Binge eating disorder has only recently been identified by doctors as a separate entity. It affects around 3% of women and 2% of men, but it is particularly common in those who sign up for weight loss programs, with estimates of 30 to 40%. As I said earlier, unless it is addressed, weight loss maintenance in particular is unlikely to be successful. By frequent binges, we mean at least one per week, and people feel bad afterwards, often guilty and self-critical, tearful, and low in mood. So what might spark off an episode of binge eating? If somebody diets too strictly and you become just altogether too hungry, then this predisposes that person to binge eat. In a similar vein, if you have a dietary rule not to eat a particular food, let's say chocolate or cheese or biscuits, and you have a craving which leads to you breaking that rule, then you can get a what the hell feeling. Control is lost and a binge can develop. Feelings, thoughts, or memories that are hard to deal with can trigger a binge. This can be called emotional eating, when the binge helps to relieve, at least for a wee while, feelings of tension or low mood, negative thoughts, or unpleasant memories. Problems with people in your life, ranging from friends and family members to work colleagues, can be triggers, but also boredom and loneliness can be cited as feelings that people have before they binge. One of the problems of binge eating is that it can be part of a cycle. And this cycle can reinforce itself and thus can be difficult to break. I hope this slide is reasonably clear and that it shows how the various factors can feed into each other. So binge eating itself can cause some of the problems, like over strict dieting, along with negative thoughts that have triggered binges in the first place. So, in simple terms, binging makes you feel bad, and this can trigger further binging. When we think about how to tackle binge eating, as you might suspect from this slide, a variety of approaches are likely to be deployed. A close look at the factors, an assessment as to whether counselling is likely to be helpful, would be an obvious step. A variety of techniques can be used depending on the particular issues identified for each individual person. Learning some straightforward problem-solving skills is often useful, so the difficulties can be dealt with using solutions that do not include food as a remedy. And at a more practical level, there would be encouragement to get into regular eating patterns to avoid becoming excessively hungry. The overall approach, as you will no doubt appreciate, is to break into these vicious cycles. If people in the Temple V program have full-blown binge eating disorder, then we would favour a psychological assessment to complement the questionnaires that you completed at the start of the program. As in the previous slides, tackling the problem will usually involve some or all of these approaches. Not everyone will want to go down the assessment or counselling route, or you may feel that binge eating is only a small issue and not a major problem for you. If this is you, then you may want to read a good self-help book. The one in this slide by Chris Fairburn is probably the best self-help book around. So, here's a quick summary. The cardinal features of binge eating are that it involves a lot of food, usually consumed rapidly, and the person feels out of control. It's common in the general population and is very common among people who start on weight loss programs. For these people, it complicates weight loss and has an even bigger effect when one is trying to keep off any lost weight. There are several things that feed into vicious cycles, including eating patterns, life stresses, and difficult emotions. We would advise further psychological assessment with a view to considering counselling, and the options can be discussed with your Temple V doctor. Thank you for listening.